Believe it or not, we're actually blinking 60% less when we're on computers than when we're not on computers. So these can really lead to eye strains. So making sure that you're following the 20-20-20 rule.
Hi, welcome back to Aggies Talk Health, the podcast brought to you by Student Health and Counseling Services and the Student Health Advisory Board. I'm your student representative and host today, Dana Ott. So today we're diving into something we often take for granted, our eyes. Between online lectures, endless scrolling, and those long nights staring at study notes, our eyes go through a lot. And for students who wear contact lenses, it's even more important to pay attention to your eye health. So to help us understand how to take better care of our eyes, I'm excited to welcome today's guest, Manny Shafqat, or Manny as many of us may know him, an optician here at the UC Davis Student Health and Wellness Center. He works directly with students on all kinds of vision needs. From glasses to contact lenses to eye comfort and safety, Manny is our expert. Manny, thank you so much for joining us today.
My pleasure.
So I just want to find out a little bit more about your background. What inspired you to become an optician, and how did you find your way to working here at UC Davis?
Well, thank you for having me, Dana. So my journey to becoming an optician was inspired by a lifelong passion for public health and a desire to provide accessible, high-quality care. I bring with me nearly 20 years of experience in eye care, providing patient education, prevention, and promoting long-term health outcomes. I earned my Bachelor's of Science degree right here at UC Davis, which helped me lay down a strong scientific foundation. Followed that up with a Master's in Public Health for University of New England, which deepened my commitment to advancing health equity. I also then received my Certified Health Education Specialist certification as well. I had the honor and an opportunity to help launch this program here about 12 years ago in 2012. The optometry and optical program at UC Davis has been a great success. We continue to serve diverse student population here, providing direct eye care. My work combines clinical expertise, passion for health education, working with students directly, and it's truly been a rewarding part of the journey for myself, and it is great to work with students on a daily basis, seeing myself in them at one time, so I really enjoy that part.
So I am really curious, what does your day-to-day work look like as an optician here at the Student Health and Wellness Center, especially working with the student demographic?
My role as an optician here at UC Davis goes far beyond than just fitting people with glasses and contact lenses. It is rooted in patient education and advocacy. I help students navigate their vision insurance, explaining coverage and options so they can make informed decisions. Many students are new to managing health benefits, so I take the time to explain them the process and so they can maximize their benefits. I emphasize ocular education, which helps them break down their prescription, so really letting them know what is it that they were diagnosed with and what does the prescription mean. You know, when you look at a prescription, there's numbers on it, so I help them explain what that means when it comes to getting their first pair of glasses. Learning how to wear and care for contact lenses. I collaborate with our eye clinic team on a daily basis, ensuring smooth clinic operations and continuity of care. My responsibilities include in the clinic, contact lens training, helping with imaging when it comes to dry eye syndrome management, and then also my focus is on delivering comprehensive care in the optical center here. Working with a diverse university setting allows me to build connection with students on a daily basis, and it's been an honor.
Yeah, well, thank you so much for doing all the work you've put in so far here at the center.
Thank you.
I'm so happy to have you.
Thank you.
And I know earlier you expressed that you also wear contacts.
Yeah.
So there's also so many students here at UC Davis who also wear contacts. Some started in high school, maybe some just switched over more recently. So what are the basics that every contact lens wearer should know, especially when wearing them long term?
So the main thing that we should remember are that contact lenses are medical devices, which requires appropriate handling. So the core basics that every wearer should know for contact lenses is that hygiene is critical. Always washing and drying your hands before you're handling the lens. So never using tap water to store the lens. lens, this can introduce harmful bacteria. Also following the prescribed wearing schedule. So contact lenses come in a daily schedule, a bi-weekly schedule, or a monthly schedule. So making sure that you're not overwearing your contact lenses, which also again can lead to increased chances of infections. Then replacing your lens case regularly. So if you're wearing a lens that's a monthly lens, making sure that the case is being also cycled through, that you're not using the same case. Again, this can introduce contamination. Replacing the solution as well. These are basics that we should all remember when wearing contact lenses. The point here is this can allow to prevent long-term effects for a contact lens wearer, and then giving your eyes a break. So not wearing contact lenses all the time. Alternating between glasses and contact lenses is important. Long-term wear can lead to dryness issues with contact lenses. And then finally, watching for signs such as redness, discomfort, discharge, which can lead to problems. So just coming in and seeking help for those. These are important tips. And then also getting an annual eye exam.
So what are some of the most common mistakes you see students make when it comes to contact lens care?
One we have to realize, students are very busy, and I understand that, but I see that students come and tell me that they slept in their lenses. This is a problem because it is preventing oxygen from fully getting into your cornea, which increases the risk of serious infections like corneal ulcers, for example. Another problem is extending the wear beyond the recommended schedule. So wearing a daily lens for like 3 days, for example, that can also lead to irritation, eye infection. Another problem I've heard and I've seen students do is using tap water instead of the contact lens solution. That is something that can introduce bacteria and that can be very harmful for your eyes, so never use tap water. Then topping off old solution in the case, so not really replacing the solution for contact lenses, but just topping it off, and that is not a practice that we want to do. And then also ignoring symptoms or delaying eye exams. So if you had an eye exam a year ago, you should really come in and get another eye exam. It's an opportunity for your vision to be updated, also for us to look at the health of your eyes. So these are some mistakes that happen, but these are preventable, and with proper education, I think these can be addressed.
Yeah, thank you so much for sharing some of those. I definitely should take your advice and go ahead and book an appointment.
Do it.
I'm really curious, have you had any students come in with any serious issues from wearing contact lenses incorrectly? What kind of problems can also develop with that?
We have students that come in with red eyes all the time, and sometimes it could be a foreign body, but with contact lens wearer, you will notice that some of the issues that we deal with are corneal ulcers. So these are people that may have slept in a contact lens and have not been replacing the lens appropriately. So this can lead to permanent vision loss. It could also lead to ulcers. Other issues are severe dry eye syndrome. So this is triggered by overwearing the lens. Students are studying late at night, sometimes just falling asleep in the lens. Other issues that I've seen students come in are eye infections or keratitis. This is an inflammation of the cornea. This is something that is preventable again, but requires intensive treatment, putting students on antibiotics in that cases. Another issue that I've seen with contact lenses is GPC, or giant papillary conjunctivitis. This is a result of poor cleaning practices, so using water to disinfect the lens or not the appropriate solution. So this can introduce bacteria or other rare infections. So this requires intensive treatment if a student is dealing with that. So these are some of the issues that we see on a daily basis. That's why we try to emphasize education when they're first coming in to get fitted for contact lenses.
Thank you so much for pointing those out to us. For the students who experience dry eyes, especially during allergy season, what are some signs that they should watch out for?
Some of the main signs for dry eyes, we have to understand Davis is a very agriculture place, so there's a lot of pollen in the air. Dry eyes are very, very common. So some of the symptoms that are around dry eyes are burning, stinging sensation, or feeling that gritty sensation that there's a foreign body in your eye. Redness, so just having watery eyes typically. This is ironic because dry eyes often triggers excessive tearing, but that tearing is an irritation response and lacks the proper oil layer, so you feel more watery eyes. Blurred vision is another symptom that you'll notice with dry eyes. eye fatigue. Our students are on computers all the time, right? I mean, within the pandemic, there was an epidemic of everyone on Zoom, so a lot of blue light exposure and not blinking enough. So this can cause dry eyes as well, and just light sensitivity. So photophobia is another one of the symptoms that is around the dry eye as well.
Artificial tears can seem to be everywhere. How do students know what kind to pick? And do you actually think they are helpful?
Artificial tears are great. I mean, the key there with artificial tear is going for something that's preservative free. If a student uses drops more than 3 or 4 times a day with contact lenses, preservative free option is the way to go. Also knowing when you go to pick out these drops that not going for the redness relief drops, they're getting the red out, but these contain vasoconstrictors, which temporarily reduce the redness, but does not address the underlying issue of dryness. And then just checking contact lens compatibility, making sure that the lenses, if you are a contact lens wearer, the drops actually do allow you to use them with contact lenses. Yeah, so there's a lot of artificial tears, and they're great if picked correctly, and can help really anyone that wears contacts or does not wear contact lenses. And we actually here at the Student Health Center at the pharmacy provide a lot of these over-the-counter eye drops for artificial tears, and they're very popular between students here.
Kind of mentioned earlier, which is so true. Students are like always on their screens. There's really no escape if we want to get things done. So with all the screen time we're getting, do you have any practical tips for reducing eye strain during study sessions or Zoom marathons?
A lot of blue light exposure, right? So we're focusing on computers. Believe it or not, we're actually blinking 60% less when we're on computers than when we're not on computers. So these can really lead to eye strains. So making sure that you're following the 20-20-20 rule. This is something that we preach here in the clinic. For every 20 minutes you're on a computer screen, looking away at least 20 feet away for 20 seconds, and then really forcefully blinking your eyes to activate the glands to produce the tears. So adjusting your screen position is also a good one to making sure that you're not straining. And then the lighting, making sure that you have the blue light blocker on your lenses. We encourage that when we do glasses fitting here. A blue light blocker is very affordable option for a lot of our students. It actively blocks out the short wavelength blue light, which studies have proven are not very healthy for your retina.
So many students might not think about regular eye exams, especially unless they like actually notice a problem.
Right.
So how often should students get their eye checked?
So we always say getting an eye exam once a year. Annual eye exams are very important. Not only are we updating your prescription when you're coming in, but we're also looking at the posterior segment of your eye. So checking the health of your eye, ensuring that contact lens fitting is still appropriate for these students, updating the prescription, and then this will allow them an opportunity to come out in optical and get appropriate eyewear. So even if there's a small change, we can catch it. So getting an eye exams every year. The benefits that our students have here through their insurance is an annual eye exam covered every year. So we highly encourage, if you are a freshman coming into UC Davis, to get an eye exam once every year. So 4 exams before you graduate typically. But that is something that we always talk about. It's a great measure.
So some students might have a little bit of nervousness coming in to see an optician. So if somebody hasn't seen one before or isn't sure where to start, what advice would you give them?
Don't be hesitant, don't be shy. I enjoy working with students. Come in, make an appointment, really get to know what benefits you have available through your insurance plan, and we can help you, educate you on what the coverages are, help you schedule an eye exam. These are life-saving measures. Sometimes, when people come in and, we had a student not too long ago that someone coming from an international country, a developing country where eye care is not very accessible, and was getting an eye exam for the first time, and it ended up being a high minus actually, and when we put on the first pair of glasses for him, it was life-changing for him. I still remember that experience, dispensing those glasses to him, and he was just so thankful for the service. So it is something that we take for granted, like you said, but we are here to help you navigate the process, and just come in, talk to us. We love working with our students, and we want to make sure that you're having appropriate vision when you're sitting in those big lecture halls.
So before we wrap up, what's one simple habit or piece of advice you wish every student would follow when it comes to their eye health?
One advice that I'll give is making a conscious effort to following that 20-20-20 rule. So for every 20 minutes you're on the computer, looking away at least for 20 seconds, at something 20 feet away, and then forcefully blinking your eyes, which helps activate the meibomian gland. So that is something that I highly encourage. And then also remembering to take small breaks, staying hydrated. These are all little things that can help your visual experience.
Well, Manny, thank you so much for your insight, experience, and practical advice. I think a lot of the students are really going to walk away from this conversation with a better understanding of how to take care of their eyes and hopefully make a few healthy changes. Thank you for our listeners for tuning in to Aggies Talk Health. Remember to take care of yourselves, including your eyes. I'm Dana Ott, and we'll catch you next time.